Hello, dear colleagues. How are you? My name is Mynzhylky Berdikhojayev, and together with my assistant Sheikh Mohammed Khan, we are from National Hospital of the Presidential Affairs Administration Medical Center, Almaty City, Kazakhstan country. Kazakhstan is in the Central Asia. It's a huge territory with a 20 million population. I'm here. Hello. And today we have a anesthesiology team, Dimash, like Dimash Kudaibergen, but this is different Dimash. Dr. Dimash, and with anesthesiology nurse. They are changing every couple of hours. And also we have a anesthesiology nurse and operating nurse is Zoya, with the second nurse Nazm. And the video support today, as usual, Evgeny Grishayev. He's the boss of the video on KZ company. We are working with Evgeny since 2017, and the next year it will be 10 years after the first NeuroAddict conference in Almaty. And yes, at that time we started our collaboration with Evgeny. And it's not just a collaboration, it's a friendship. It's a friendship for more than 10 years. Yes, I really calm, and I can rely on Evgeny and the video company KZ, and also the team of Presidential Hospital in Almaty. I'm just coming for the cases, and after cases I'm traveling to Astana, because I'm living in Astana nowadays with my family, with my wife Laura and my 3 children. I just arrived yesterday late night, and today after cases I hope I can travel back home. And tomorrow I have cases in Astana Presidential. And also my father is hospitalized in Astana Presidential after stroke. And he is doing well. He says thank you for all colleagues to supporting me and my father. Thank you, really. Yes, and this is a case number 3 under general anesthesia. We did this angiography for all vessels, for all brain vessels, and 3D angiography for the left ICA territory. And now you can see the aneurysm. It's approximately 3 millimeter. And aneurysm is located on the M1 segment on the left side. Right side. Right. It's the right side, yes. And it was a little bit doubt about is it some perforating branch from the aneurysm. We tried to see the NPR, and we tried to analyze the NPR. Aneurysm is here. There's some branch coming from the neck region. It's something like here. It's look like we're in a safe position. Yes, we can do just a balloon assisted coiling. I hope so. On 3D it's a 3.2 by 3.5, yeah? Yes, it's like 3 millimeter. Yes, the artery is approximately 2 something millimeter. And let's measure the aneurysm from the MCA till the top is 3 millimeter. And the width is 2 millimeter. We are planning to do catheterization of the MCA with the Scepter 415, and then we'll place Neuroslider 17 inside the aneurysm, and after that we will place first coil Newman coil 2x4 Egditor. It's a fill coil, electrically detachable from the microport company. İmlanda bir salsa. As the first coil will be helical 2x4, and the second coil 2x4 will be 3D. Okay, let's leave it here. Yes. And the attachment system is quite unique, huh? Okay, and attachment. Internal battery DC 3 volt alkaline batteries, Microport Tech, Neurotech Shanghai. Okay, let's see. Something new in the catalog, it's a green. Before it was orange, gray, white, now it's a green. Okay. Okay, let's start. Yes, it's a new coil system from the Microport company, and distributor for the Microport in Kazakhstan is Aliva company. Yes, they're doing a good job, and yes, all companies in Kazakhstan are doing nice job, and all products available in the world are available in Kazakhstan now. Yes, time to time, because of the tender system, some of the products is not available. But it's not because of the company, it's because of the tender system. Okay. Stop. Stop. Назад. Назад. Stop. Oslan. Smart mask. Okay, first of all, through the Neuron Max and short 8 French machines, we will navigate the Scepter balloon, which is, I think it's 415. Scepter'ın razmerini айтасаш? Zoya? Scepter'ın razmerini айтасаш? It's 4x20. Yes, it's look like longer than we usually use. Yes. Тағы бір Y коннектор берсе, и тағы бір система жалғайсың. Yeah. Yes, as I used to joke, Sheikh Ahmed is a neurosurgeon, micro neurosurgeon, and yes. Yeah, blood. Yes, we need one more. Yes, and my colleague Yalalt from Ulaanbaatar sent me through the messenger the photo from Ulaanbaatar, and they're looking for the cases from the morning. And Adnan Siddiqui, my old friend from Buffalo, United States. Job емес, обычного коннектора. Болтовый коннектор. Adnan is doing workshop in Adnan is doing workshop together with Gambatar and the team of the Mongolia. Басқа жоқ па? Yeah, бере сал. And team of the Ulaanbaatar, Mongolia. The workshop focused on brain AVM. And I really wish this successful workshop and quick recovery for the patients. Yes, Adnan is very experienced in brain AVM and he can do both microsurgery and the vascular. He's from Buffalo, United States. Yeah. Yes, the balloon assistance with the Scepter 4x20. It's a double lumen balloon, and now we asked for the coiling catheter, which is Neuroslider 17. Unfortunately, the Terumo Neuro could not provide the headway because of the registration process. The whole documentation is not ready. That's why we should work with the different manufacturers. I usually hate this condition because I prefer to work with the most comfortable instruments, and if you used to work with the headway, then it's better to work with the headway. Yeah? Okay, we'll leave the Scepter here. Now the Neuroslider is also here. It's also in Tashkent with the team of Medicover. We are working with the Medtronic Phenom catheters. For me, the Phenom is more close with quality and characteristics to the headway. Yes, I really enjoying the work with the headway and the Phenom microcatheters. Yes, and I'm not so happy to work with the Neuroslider. It's quite stiff device, and now we are trying to push it inside the aneurysm. It's not going, eh? Okay. Yes, it's a balloon Domkrat. It's not also all the time for the remodeling, but it's really helpful for the navigation of the micro instrument. Okay, let's deflate the balloon and then we can do the control angio. As when we work with the aneurysm, I prefer to work with DMSO compatible instruments, and Neuroslider is not DMSO compatible. That's why I'm scared about the possibilities of the instrument, but it's okay, it's all okay. The first coil is 2x4 helical, Newman helical. Okay, let's look for the coil. Yes, it's helical. It looks soft, but let's see inside the aneurysm how it will behave. Видишь? Она же не сваргана, да, фиксатор? Yes, the package like a delivery wire is like a microplex. Let's check. That's okay. I think it's similar to the microplex. Huh? Let's see. How much is soft. Maybe we'll place couple of coils after the placing the first loop of the coil, and we can pull a little bit the scepter. Okay. It's look like not so stiff. It might be a little bit stiffer than the coils. Just a second. You should pull a little bit the scepter. Yes, now it's better. We are in safe position. Now we will do angel. It's okay. Maybe we can place one more microplex coil, or maybe it's enough, huh? Maybe one microplex, let's see. Okay, let's detach. It's the first Newman coil in our department. It's pulsating, and then it's a voice. It's approximately 6 seconds. Not 3 seconds, yeah? 3-4 seconds. Detachment. Даже екі тартымыз. Бір жарымда екі бар ма? Микроплекс бір жарымда екі, бір жарымда екі. Контингент деп тұр. Сонысы. Yes, it's a 3D 1.5 by 2. Yes, for me, the Newman, if the size of the aneurysm is measured correctly, the coil look like a little bit stiffer. Yes, it's a 3 mm, but the coil behave 2 mm coil behave more than 2 mm. Yes, that's why we choose the coil not 3 mm, we take the 2 mm, and it fills the aneurysm fully, nearly fully. Yes, we will keep it in mind, and we'll take 1 mm less for the future. Чуть-чуть котлоген. Спираль чуть-чуть котлоген. And the second coil will be the microplex. Yes, I expected that this coil will be a little bit stiffer than we usually use. It's the Optima from Balt and the microplex from Turmanera. I can feel the difference. I will release a little bit, relax the microcatheter. Yes. It's soft. Okay, the catheter is outside. Okay, let's try this one. Sometimes it works, sometimes it's not. It's working, eh? Let's see. Let's see. It's a detachment system from Newman coil, and now we're trying to detach. It's not detached. Okay. No, it's not detached. Huh? It's not detached. Okay. It's not detached. I hope the via track system will detach. Okay. Yes, now it's detached. Because the per-denser coil has the same detachment system with the microplex system, and we can detach with the via track the lap of per-denser coil, and with the per-denser detachment system we can detach the microplex coils. Maybe this detachment system for the striker. It's look like the same system with the striker. Okay, now we'll take out the coiling microcatheter. Okay, it's out. Well, maybe for some companies is not recommending to do so, but in a resource limited in resource limited countries it works. Okay, 2 coils. And uncomfortable part with the electrical detachment system, we should buy one more detachment system to detach another coil. Huh? Yes, aneurysm is occluded. Let's do AP and lateral. Yes, aneurysm will create the coil will create the fibrosis and the scar tissue, and it will be occluded during the long-term follow-up. Okay. Let's pull the guiding to the common carotid to exclude all possible complications. The venous phase is clear. Okay, let's take it out. Okay, let's do экспресс-CT. Подозрение на... Okay, let's check. It's look like spasm. Maybe it was before. Something was before. Okay, this is control. Is it the same position? No, it's not the same position. This is the same position. And let's check the APN valve. Oh yes, it's very nice that Shachmet is noticed some irregularity here. This one, it looks like stenosis here. This patient survived from stroke in hemorrhagic stroke in occipital region. It's a lady, yeah? It's a male, yes. Yes, at the beginning it was presented, yes, it's a stenosis. Slight stenosis, but let's check the... There are stenosis here. Let's check. Yes, here is the stenosis. Yes, it was hemorrhage on the right occipital region, that's fine. Such kind of changes is expected. Yes, this is hypoplastic, and this is 3D. We need to check the right vertebral. There is no right vertebral angio. Okay, Sheikh Ahmed will do the right vertebral angio and then CT. Okay. Brachiocephalic trunk is here. We couldn't see this spot. It's okay, maybe it's hypoplastic and this segment is stenotic. No problem. Okay. Let's do expert CT and finish the case. Okay. This system we will keep. Zoya. Почта. Okay, dear colleagues, expert CT is ready. It was not in the right side, it was in the left side. It's a scar tissue, yes. The right side is stenotic, and it looked like something here. And the aneurysm was on the right side. Okay, let's ask Sheikh Ahmed to do MR angiography before the discharge to check the territory. It's look like okay. The brain is clear. This is from the previous stroke. And now we're finishing the cases, and it was only 3 cases scheduled for today. And I hope to see you on Sunday. Maybe we'll plan some cases on Sunday. And my plans completely corrected for the last 3 weeks, and I don't know exactly what will be tomorrow. Thank you for watching, thank you for commenting, and see you online maybe on Sunday. Bye bye.